Hi, okay. I would like to go in a little bit more detail about the elimination diet. Sometimes it can be a little overwhelming when you have to change your diet completely and take out a lot of foods that you rely on regularly. So hopefully I'm just going to kind of clear up any confusion you may have and also just give you some helpful tips so that you could be successful with the elimination diet. One thing I really want you to just keep at the forefront of your mind is, why are you doing this? Why am I making all this effort into the diet? Maybe you have chronic fatigue, maybe you have constant pain, maybe you do not sleep, you don't have, you're not feeling your best, you can't function at work, you can't function at home. Whatever made you join this program, I want you to just start thinking of how much better your life is going to be. Think about yourself doing those activities with your kids or your family, doing well at work. Maybe you like going hiking or running or biking or doing yoga, some activity that you haven't been able to do. Whatever your goal is, I want you to keep that in the forefront of your mind, because it is going to be difficult when you're changing your diet, in particular in the beginning. So it is the hardest in the beginning. You're going to be going through some withdrawal, especially if you've been drinking Cokes or anything with sugar or caffeine. If you've been eating things with milk in it, breads, pastas, sweets, any of that, even if it's a small part of your diet, you're going to be taking that out and you will be going through some withdrawal initially. So please just always keep the positive, and that will help motivate you through this process. Now, the biggest thing that I can say is, please plan your meals. Plan your meals, plan your snacks for the week. If doing the whole week is difficult for you, maybe you have 2 days a week that you can prep your meals. That would be great. I typically cannot do any meal prep in the middle of the week. So my prep day is always Sunday afternoons. I take about 3 hours to bulk cook my meals for the week and my snacks, so that I always have food available for me to keep me on track. Initially, it may require more time because this is going to be a new way of eating. Some of the foods that were quick and easy, you can't eat right now. And so you're going to be having some new recipes. You're going to be looking for some new foods in the grocery store. So grocery shopping could take you longer. Meal prep could take you longer, but it will get easier. The more you do the plan and the deeper you get into it, one, you're going to be past that withdrawal phase. You're going to be feeling good, and then you're going to get used to the foods. Shopping will get faster. Meal prep will get easier. And remember, feeling bad is only for typically 3 to 4 days in the beginning. You will feel good. And often when I get to the reintroduction phase of a diet with my patients in a few weeks out, they don't want to add the dairy back in. They don't want to go back to the wheat because they feel so good. So remember, you will feel better soon. Just hang in there and push forward, and hopefully I will give you enough tools to make this a very easy transition. How long do you need to stay on the diet? I get asked that question all the time. Typically, you need to be very strict for a minimum of 23 days. Why such a specific amount of days? Well, it takes approximately 23 days for the immune system to downregulate after it's had all of those pro-inflammatory foods in your diet for such an extended period of time. Your symptoms actually could get worse. So if you have fatigue, you could get more tired. If you have headaches, you could get more headaches. You could have some GI upset. It is very common. Again, like I said, it's 3 to 4 days. I've had some patients go as long as a full week, but I would say that is not the norm. And just some reactions, I had mentioned them before, but you could get a little dizzy. You could get some muscle stiffness. You could feel like you're getting sick or coming down with the flu. They are all withdrawal symptoms. They are all very normal. The best thing you can do is just hang in there, drink water, and just stick to the diet. Now, what can you eat? You were given both of these sheets. We would have went over them on your appointment. Typically, most people can eat everything on this nutrition plan. You will see at the bottom there are some markers for high histamine foods, nightshades, and fermented foods. If you can't eat any one of these 3 categories, I would have went over it with you. So you know, okay, I can't have high histamine foods or nightshades. If I did not mention that to you, then you can eat everything on these 2 sheets. These 2 sheets were also uploaded to your Get Healthy account, so you always have access to them. Now, snacking and eating out. I always recommend, again, when you meal plan for the week, you should be meal planning your snacks as well. If you work full time, snacking at work, even sometimes eating breakfast at work, is a norm. So you need to make sure you have food at work and food at home. You want to keep snacks, even salad dressings, something that you know that you can eat that is quick and easy for breakfast, lunch, or snacks at work. I do not recommend traveling. It is very, very difficult to maintain this plan while you're traveling. You don't know how food is prepped in the back, and you can ask as many questions as you want to your server, or even ask questions back to the cook. But you really do not know all the ingredients that are in there. Sometimes they don't know all the ingredients that are in their food. So just try not to eat out. Traveling during this time is not recommended. It is very difficult to stay on the elimination diet while traveling. If you do have a trip planned and it's in a week, or even 10 days of starting this plan, what I would suggest doing is taking out the major offenders, dairy, wheat, doing your best while traveling, and then when you come back from your trip, then starting the very strict elimination diet. It is, I think starting it before traveling is just going to set you up to be unsuccessful, and that's not what we're trying to do. Okay, so big tips again. Plan, plan, plan. If you do not plan your meals, plan to fail. It is, like I said, it's difficult to stay on this plan if you do not set out your meals and snacks for the week. The other thing is, don't go hungry. I have so many patients that tell me they're starving when they're on the diet initially, and it's just because they're not used to eating these types of foods and don't realize that you need to eat more of these foods to fill you up. So when I have a salad, I actually use a mixing bowl as my salad bowl. So I eat a very large salad. I do not use a salad bowl. If I were to eat a salad in a salad bowl, I'd probably be hungry an hour later. And try to eat regular meals. Skipping your meals are going to make your blood sugar drop. It's going to make you feel terrible. Your energy is going to be bad. Could get headaches. So please eat consistently throughout the day. If you are hungry, eat. Do not starve yourself. And the last one, try to choose organic. I realize organic can be expensive. So there is a list out called the Dirty Dozen, which are the fruits and vegetables that have the most pesticides. If you can just stay away from the ones that are the high pesticides and try to choose those as organic. When it comes to buying organic, just do the best that you can. And just really try to thoroughly wash your fruits and vegetables before eating them. When it comes to oils, choose cold-pressed oils, because if they're not cold-pressed, then they're heated, and that typically will break the oil down and cut the nutritional value down. Eliminate caffeine. Caffeine is not on the diet. If you were drinking 2 cups, then go to 1 cup, then go to a decaf, and then cut it out. You can have caffeine-free herbal tea, caffeine-free green tea. Drink lots and lots of water. I will put water recommendations on your Get Healthy account. That will be one of your goals initially, is getting enough water in. Typically, most people are shooting for 80 to 100 ounces a day. You can add organic lemon or lime to make it taste better. Organic lemon is also very cleansing to the liver. And lastly, try to get as much sleep as possible. Your body repairs when it sleeps. So take a nap. There's nothing wrong with taking a nap, especially in the beginning. Get as much rest as you can. Also, light exercise. Just getting outside and getting your body moving, even if it's for 15-20 minutes a day. That is great for the body. It helps the body detox and helps get oxygen into all of your cells and it will make you feel better. It will clear your head. And down the road, we can add in different types of exercise. But right now, just getting outside and walking would be ideal. So I hope that this clears up some, concerns or questions that you have on the diet. And just remember, any small change that you make today is going to add up to a big health change later. So good luck. If you have any questions, I'm always available.